My name is Daudi Mugisa, and seated beside me is my wife, Dr. Regina Mbabazi Mugisa, and we came to Yashoda Hospital to get medical attention for a sarcoma which was growing in the soft tissue on my right elbow. We are from Uganda. I first had the first surgery in Uganda. They removed the swelling December last year, and but by mid-January this year it had grown back. I think there was also a case of misdiagnosis. In Uganda it was diagnosed as benign, but when it grew back we sent the specimen to Metropolis Lab Mumbai, who diagnosed that it was a sarcoma. And so the oncologist in Uganda, Dr. Okuku, advised that we come to Yashoda hospitals. And indeed, it was a good choice, because in case you don't know, Yashoda means destined to succeed. And so we were received by Dr. Srikanth, the senior oncology surgeon, and his entire team. And they worked together, Dr. Harish, senior medical oncologist, and with Dr. Kiran Kumar, oncologist, and later on the senior plastic surgeon, Dr. Sanjeev, and his team. Between these senior consultants, and I believe with their juniors and other staff, they came up with a solution. We had initially come here for 10 days to have surgery and then go back. But at that time, Dr. Srikanth said that if he was to go in at that time, he would need to amputate the hand. And that was not something palatable to us. God gave him wisdom. I met him yesterday, and he said that he took 3 days to think about a solution. And I thank God that God gave him a solution, gave them a course of action, which was 2 doses of chemotherapy, 1 week of chemotherapy, 16 days of rest, and another second week of chemotherapy and 16 days. The target was to shrink the sarcoma by 30%, but we thank God, God shrank it by 50%. So the first surgery was to put a chemo pot where they would administer chemotherapy, and we thank God that it was successfully. Then the second surgery was to remove the sarcoma. Fortunately, it was in the skin. Under the skin, no bones were affected and no muscles were affected. So the second surgery, Dr. Srikanth with his team, they removed the sarcoma, and then the plastic surgeon, Dr. Sanjeev, had to cover what they had removed, and he used a flap from the stomach, from the abdomen, and put it on the elbow, and my arm had to be kept in this position, fixed for 3 weeks, and they used metal things to fix it. And God saw us through that pain and inconvenience. And finally, when the 3 weeks were over, they disconnected, they separated the flap, covered the elbow and the stomach. I think this was when? 1st June. And so now we are on physiotherapy to get the arm back to full functionality. But in all these stages, the medical staff, the nurses, the administrators, the support staff, all the way from top, from Mr. Hari Koduri, the Assistant General Manager, International Services, and all those medical consultants and their junior staff, the nurses, people who looked after us, helped us in the ward, cleaning, personal hygiene, because at that time when the hand was fixed, I could not help myself. They had to help me. I really appreciate all of them for what they allowed God to do in and through them. The cleanliness was excellent, and many others. So we really appreciate, we thank God for all of them and for Yashoda hospitals. And indeed, as I said earlier, the name Yashoda is appropriate. Yashoda means destined to succeed.
Hi, I'm Dr. Srikanth, Senior Surgical Oncologist, Yashoda Hospitals, Somajiguda, Hyderabad. This patient, Daudi Mugisha, was presented to us with actually a recurrent tumor, soft tissue tumor in the right elbow. He was operated their country some time back, where they did a wide excision of the tumor and just to preserve the arm. Then he was okay for some time. Maybe I think in 6 months or 8 months time after the surgery, he developed a big recurrent tumor there. The size of the tumor was almost from mid-arm to the proximal third of the right forearm. So the whole elbow was involved, skin, soft tissue, it was involving or abutting the elbow joint. So he came to us with a terribly bad ulcerated lesion in the right elbow. So the only option at that time was amputation of the arm or a disarticulation of the shoulders, because the edema was extending almost nearly up to the axilla. So possibly there was some infective component also in that. So then after thorough investigative workup, he didn't have any distant mets, fortunately, either in the lungs or bones or skull or brain or liver, nor did he have any regional lymphadenopathy. So fortunately for him, these things were not there. So what I decided in our Tumor meeting was that we'll subject him to neoadjuvant chemotherapy. All this effort was to see that he doesn't lose his arm. The idea was to save his arm, so that it's a right hand, a dominant hand, and very important for his daily routine activities. So after a thorough discussion and then thorough evaluation of him, so we decided to give him 2 or 3 cycles of chemotherapy. Then we thought we'll reassess him. So we have explained him clearly that this attempt was to save his hand. So if this fails, then we have no other option other than removing his arm. He went through chemotherapy, I think 3 weekly regimen of chemotherapy, and then after 3 cycles we did reassess him, and there was a significant reduction or response in the size of the tumor. So after evaluation, a reassessment scan was done, which showed a more than partial response, and the joint space looked reasonably good. It was not infiltrating into the joint space. So what we decided was to do a free flap or a local flap for him to save his arm. So we did a wide local excision for him, giving a negative margins all around, and then we put a abdominal flap for him with restriction of his movement of his hand for about 3 weeks or 4 weeks. Then after that, the flap was divided and then reshaped, so that defect in the abdomen was also closed. The post-op histopathology revealed the margins were very clear, and the tumor, whatever was there, had good response to chemotherapy. Fortunately for him, though he had a long stay here, but the only best thing what we could tell is that he went back to his country with his arm, able to eat, able to do his things on his own, though there was a little bit of cosmetic deformity, but still he was happy. All these things can be covered by wearing a full shirt, and he didn't have to take adjuvant radiotherapy also, because the extent of tumor was very small. So this was the thing what we did, and the main part of this is that we could salvage his limb. It was a happy patient who went back to his country, and he can now do all the things on his own with his hand, because I think he was an employee in the government who had to do a lot of work, signatures and all that. So that's how it is. So we did ask him to come back after 4 months for a follow-up, but we could salvage his limb, which was technically not feasible at presentation. We could make it possible to see that his limb was saved.